What's up guys, I'm in the operating room. Let me show you how I'm going to do some ear tubes. So once the patient is under anesthesia, I take a look with the operating microscope or with a sinus endoscope. This is a sinus endoscope. The eardrum is about 1 centimeter and this view is magnified by about 10x. I intentionally left this video in real time so you could see how quick it could be. The first step is to take the myringotomy knife and make an incision in the anterior inferior area. This is the safest area to make this and to place the tube. The knife, as you can see, is very sharp and these are microscopic movements. Once the incision is made, you're going to see the mucus pop up that was behind the eardrum. That's it right there. I usually start with a 5 millimeter suction to suction out all the contents of the middle ear. In this case, this mucus is very thick, so I'm going to switch to a 7 millimeter suction in a second. This is what we would call a middle ear effusion. It is not an ear infection, but it is what remains after an ear infection sometimes. Mucus in the middle ear like this causes more ear infections. Because the middle ear is usually drained by the eustachian tube, but in young kids it's flatter and shorter, so they're more at risk for recurrent mucus or infections in the middle ear because it never really fully gets cleared. This was the case in the patient we're seeing here. He had 3 ear infections in 6 months and had been on multiple antibiotics. So here we're going to take a 7 millimeter suction now to try to suction out more contents of the middle ear. As you can see, you're going to see them move out. And then we're going to irrigate the area with normal saline to further loosen any mucus that might be stuck in there. So another thing mucus like this can cause is a problem with hearing, and it can affect speech. The reason for this is that the hearing bones behind the eardrum cannot move correctly with the mucus there. This results in a conductive hearing loss. Children under the age of 3 are in the critical time period for speech development. They need to hear 100% in order to be able to develop normal speech. So middle ear effusions like this can cause a speech delay. It could also cause frustrations and problems with behavior. So the last step is to put in the ear tube. You can see it has phalanges on both sides to keep it in place. This is about a 1.2 to 1.5 millimeter ear tube. The tube will fall out on its own between 6 months and a year. And we're going to put some antibiotic ear drops.